Hi there. Thank you for joining me again as we continue our conversation on the many aspects of COVID-19. I am Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. This program is coming to you on television as well as radio, and feel free, if you have questions, to send us WhatsApp messages at 620-6275 or send us an email at docandcovid@gmail.com. As usual, I'm wearing my mask in studio, but I will take it off for this program. As you know, the mask is supposed to cover both the nose and the mouth, and I'm going to take it off by holding the straps that goes around my ears. And so today we want to talk a little bit about the abdominal symptoms involved in the whole COVID-19 infection. And the topic starts off basically with a question from a viewer or a listener just like yourself that was posed to us on WhatsApp. And so here is the question that came in. I tested positive more than 2 months ago. I was isolated for 3 weeks, then came back out to work. Within the past week, I have noticed bloating in the stomach. Could this be related to COVID? And this is a very important question, and perhaps more people are experiencing similar symptoms to this patient than we know of. So let us try and answer some of the concerns and some of the general areas of interest as it relates to COVID-19 infection, bloating, and in general the abdominal area of the body or the gastrointestinal system. So what is abdominal bloating and fullness? Essentially, abdominal bloating is the feeling of fullness and tightness in the tummy or the abdomen. And I'm pretty sure many of us would have experienced this at some point in our lives. Perhaps after a particular meal, after a particular type of behavior, you may see that you have an increased fullness or stiffness in your tummy, and that is well recognized. It is different than in one patient to the other. What one person can tolerate may not be tolerable to another person. And here we have to consider things like lactose intolerance in various patients who may not be able to tolerate milk and dairy products. And that is different from one person to the other. That particular condition may be somewhat more prevalent in persons of color. So symptoms of intestinal bloating can happen in anyone, and this bloating is followed by symptoms such as cramps, belching, abdominal pain, diarrhea, shortness of breath, and even lower back pains. These are all considered part and parcel of this whole abdominal symptomology that accompanies the COVID-19 infection. The common causes generally that produce bloating are things like constipation, and these are not necessarily related to COVID, but I'm just giving you a broad overview. Constipation, peptic ulcers, that's ulcers in the stomach or the esophagus, in the duodenum, anorexia, which is loss of appetite. Anxiety is also another common reason for people to start feeling bloated. Smoking, water retention, trapped air, overheating. You may find that when the place is really hot, the sensation of bloating is even more pronounced, especially in the tropics like where we live. Indigestion is another reason for you to experience bloating. And sometimes in women, it's a premenstrual symptom, and it can also be seen in the perimenopausal woman, and of course the well-known irritable bowel syndrome that a lot of patients would have diagnosed. And these are all known medical entities that needs attention and needs to be treated appropriately. More scientifically, let us look at what are the real science involved in having the sensation of bloating. So usually in the gastrointestinal tract, there is the presence of bacteria, what we call microorganisms. And these are responsible for creating the right environment for us to be able to digest our foods and produce nutrients so that the body can utilize it for its various purposes. So bloating can be caused by an imbalance of the microorganisms or the bacteria that live naturally and normally in the gastrointestinal tract. Some may overgrow, what we call small intestinal bacterial overgrowth, and that can cause an imbalance in how we process foods and how we process nutrients. Problems with abdominal gas, and we will show you, especially when you drink fluid out of a straw, for example, you take in a lot of air at the same time you take in the actual liquid. Sometimes a sensitive nervous system can cause bloating in the stomach and in the small and large intestines, which are located in the abdomen. And of course, food sensitivity and intolerance, especially as we mentioned before, the dairy products, milk, cheese, egg, these things combined when used either individually or when combined can cause severe or discomforts in the abdomen and the tummy in general. So let us look at some tips of how you can reduce the actual feeling of bloatedness or gas in the abdomen. One, it's highly dependent on our diets. So we'd encourage that one eat more of what we call insoluble fibers. Avoid straws, like we just mentioned, because straws tend to deliver not just the fluid that you're putting into your body, but also the air that is mixed with drawing it in. Avoid laying down just as soon as you finish eating. Limit the amount of carbohydrates that you take in, especially these days we have a lot of fast foods, burgers, fries, etc. These are things that can contribute to bloating. Carbonated drinks like sodas and mineral water that has the that fizziness to it, those can cause lots of bloating as well. Drink plenty of regular water, which can help to fill up the stomach and occupy the space that is ordinarily occupied by gas. Of course, exercise always helps in many things, not just gas, but it also helps in cardiovascular health, helps to control, diabetes, high blood pressure, etc. And when you're eating, it is very important to take your time, chew properly, and eat slowly rather than trying to gulp down foods very quickly. That is when you have more risk of swallowing air that can become trapped in the abdomen, in the stomach, etc., and produce this whole sensation of bloating. So generally, the gastrointestinal tract started to become a significantly affected organ system in the body the more we got to know about COVID-19. The more we knew about it, the more experience we have with COVID-19, we started to recognize that more and more persons are having complaints that involve their gastrointestinal systems. So what are the common or the main symptoms of the gastrointestinal system that is affected or produced by the COVID-19 infection. We look at common things like nausea and vomiting. That is quite common in this population. Abdominal pain and bloating can occur as a result of COVID-19. That can produce increased burping, or what you call belching in Guyana. We can have heartburn, loss of appetite or anorexia, and of course we can have patients suffering from diarrhea as part of the COVID-19 pandemic or infection. In fact, we have had documented COVID-19 viral particles excreted in stool for patients who are known to be COVID positive. So it is very well recognized in the gastrointestinal system. It's something that affects a lot of persons who have COVID-19. They have effects on their gastrointestinal system. So almost half of patients with COVID-19 have some type of gastrointestinal effects. The actual number from a study done in China, in Hubei, China, reported that 48.5% of patients with COVID-19 reported digestive symptoms as their main or chief complaint. So these are persons before they, come in with severe shortness of breath, etc. Their main complaint would involve something in the gastrointestinal tract, whether it's nausea, vomiting, diarrhea, abdominal pain, etc. So we always believe and always think of COVID-19 as a respiratory illness. We've recognized that it also affects patients in several other organ systems, including the heart or the cardiovascular system. It also affects the gastrointestinal system and other areas such as the skin and the kidneys, etc. So let us look at what we would have discussed in one of our previous conversations, the effects that are seen in what we term long COVID, where the symptoms persist beyond 2 to 4 weeks. And we look at specifically the gastrointestinal symptoms that persist in long COVID syndrome. And look at the most common is fatigue, and this can be very extreme. But as you go down the list of what is possible, there is definitely the persistence of things such as lack of appetite and diarrhea, which can be seen in about 5 to 10% of these patients on a long-term basis. And this is significant because they may be present in patients who no longer have the usual manifestations such as fever, coughing, or shortness of breath. These patients may have just persistent diarrhea, or they may have persistent loss of appetite. And these are well recognized, and we are now starting to pay more attention and divert resources to deal with these kinds of patients. The CDC looked at, or this is the Center for Disease Control, a US-based scientific organization. They looked at what happens to the post-COVID patient as opposed to when they have an actual infection. Post-COVID means after COVID, that after COVID infection period where they would have passed through that initial acute phase, and now we're more into the chronic phase. And we look at things like diarrhea, for example. In the early phases, this is present in about 50 to 60% of patients, but it can persist in about 10 to 15% of patients even after the initial phase. Nausea can be present in about 35 to 40% of patients at the time of diagnosis, but it persists in about 10 to 15% of patients even after 2 to 3 weeks of them being positive. So we see that there is a significant persistence of gastrointestinal symptoms in post-COVID patients. At 2 to 3 weeks after a positive diagnosis by PCR, about 35% of patients did not return to their usual state of health. And among young adults, 18 to 34 years with no chronic medical condition, 1 in 5 or 20% had not returned to their usual state of health. So it is possible to address this specific question if bloating can be caused by the COVID infection. Yes, it is possible that even weeks after the initial diagnosis, that the symptom of bloating may be a residual effect of COVID-19. So thank you again for joining us as we discuss continuing our conversations on COVID-19. And remember, if you have questions, you can send them by WhatsApp to 620-6275 or send us an email at docandcovid@gmail.com. Thank you again.